Welcome to Periop Talk. In this episode, we're checking in on the Future of Nursing report. This landmark document explores how to better empower nurses while reducing health disparities and promoting equity. It also helps shape how nurses can maximize technology and maintain patient and family-focused care into 2030 and beyond. It's had a major impact on the nursing profession. But specifically, why does that matter to you? Well, it's because many of the report's findings directly impact the perioperative setting. Joining me today is Renee Battier, Vice President of Nursing Education at AORN. Together, we'll explore how it has shaped our practice, what's changed since its release, and what the future holds for perioperative nursing. Let's get started.
Welcome to Periop Talk, making surgery safer, one podcast at a time, with brief, practical information for you to take back to the OR.
Renee, you've been close to this work since its inception. Why was the Future of Nursing report created? Meaning, what were the barriers? What were the goals?
Thanks, Jake. It is such a rich topic. So, in 2008, the Robert Wood Johnson Foundation and Institute of Medicine came together for an initiative to really look at what's needed to assess and transform the nursing profession. Just a small topic, right? What they came out, and I love how they focused on this, is really looking at the barriers that were keeping nurses from being able to respond effectively to a rapidly changing healthcare environment and healthcare system. So I love this quote, but the barriers needed to be overcome to ensure that nurses were well positioned to lead change and advance health. So really recognizing the impact of nurses on our nation's health. They focused on, if you boil it down, to kind of 4 different areas. So practicing to the full extent of our education and training, achieving higher levels of education through a system that allows that for smooth transitions, and nurses to be full partners with physicians and other care professionals in really redesigning healthcare. So really getting them to the table and understanding their voice. And then effective workforce planning and policy making, which also required better data collection on what's going on. But those were the elements that they really focused on to make an impact.
You know, Renee, I don't think it's ironic that when I think back to that time frame in my career in perioperative nursing, all of those things were happening in real time. And I felt as a nurse, and then when I became a leader in the perioperative setting, each one of those things kind of taken off.
Exactly.
You were in the hospital at that time. It kind of makes sense looking back.
It does. And it was a progression. I mean, there was a lot of things that had happened. We'd had the To Err is Human report already, right? That really impacted our world. And there were a lot of big changes going on, with changes in awareness of what's going on in our communities, changes in our healthcare systems, changes in our education systems, and always the worry about how do we get more nurses to where they need to be and having a full impact. So yes, those were all starting to happen, but this really helped provide an enhanced focus and really undergirding it with research and studies to help support it in a national way.
Even to that last point, Renee, the Future Nursing report then was very timely, because at that time, I mean, it feels like it's been decades and decades at this point, but there has been a gap in nurse staffing. And then there were the projections, and there's the projection yet today. And so we're working on these things as though we need nurses.
Exactly.
Right. How did we, AORN, get involved back at that time frame to support the 2010 report?
My understanding is, thank you to our CEO, Linda Groh, she organized a group to really look at what was AORN involved with and compare it to the workforce report of the key initiatives and what else did we need to do. So out of that came a special focus issue for the AORN Journal in 2013 and really covered a number of those topics that we already just talked about. So what is it? what is the IOM report and what do perioperative nurses need to know? So really trying to bring a periop lens to this. Another one that was on periop nursing and education, and what does that mean for, again, us in periop, where we're always struggling to get more of our specialty-focused nurses in the workforce. And then some other ones too on really where does this take us in redesigning healthcare. And then there was a report to the membership at the national meeting that year as well. So those were some of the key things that really helped bring a lens of perioperative nursing within the broader context of this report, which was pretty exciting.
What do you feel that lens was at the time, the perioperative lens that you're speaking about?
I think some of it was engaging us as partners in national initiatives, because I know that both in our work as well as in our identity, sometimes we can be kind of behind those double doors and think we're different. It doesn't really affect us. This was not long after AORN had become a member with ANA, so that the ANA member package was included in our AORN membership, which actually is a really big deal. And I think for advocacy, for our identity with the national nursing enterprise, it really was an important time. And this report and this work helped build on that, a sense of our connection with the broader nursing community and our role in advocacy, both within our specialty area as well as advocacy with our nursing partners in really engaging and moving nursing forward. So that's what I saw as really coming together with that to connect us and help us see where we needed to have our voices as part of this work.
And Renee, what would you say in looking back to that initial decade report? What would you say was one or two of the biggest outcomes that have kind of been long-standing now, that have kind of stuck with us that we just...
You're right. They start to feel really familiar now. Like, of course, we always had that. I think a couple of things I would add is that nurse practitioners and the working at the level of their licensure more and more and more of the time, it's still not where it needs to be, but across states, it's much more consistent than it used to be. Think about the rise in the doctorate of nursing practice roles, which not only enables clinical research more often, but also having doctoral prepared nurses in our clinical settings. And that certainly is apparent in Periop. Think about how many of our colleagues now have DNPs that really helps prepare them for higher level of work in various environments and specialty areas. And then I think growth in understanding our advocacy voice. Think about how many states now have laws around smoke in the operating room is one, and certainly the ongoing work around one circulator for every surgical patient, right? That is ongoing advocacy work as well. But I think some of that growth came from really understanding our role in having an impact and then engaging with each other and our broader nursing community to help make those happen.
Great example. Let's shift to the most current report, Renee, the 2020 to 2030 report. How do you understand the emphasis to be for this report? Is it different? Is it the same as the first one? And if so, what are the differences that you see?
Yes and yes. Different and the same, right?
Right.
Some of the issues are still challenges. I would say things such as workforce adequacy and preparation are similar. There's growth in them, but still are challenges, and a much stronger focus on health equity and the key role of nurses in communities. I think there's a very different lens on that. And a quote that I want to share that I think helps highlight this from the new report is really, a nation cannot thrive until all live their healthiest possible life. And helping people live their healthiest life always has been the essential role of nurses. And that's really that broader mission that is part of all of our work. And that nurses have a critical role to play in achieving the goal of health equity. But they need, and this is back to same as before, just more, robust education, supportive work environments, and autonomy, so that the ultimate goal is the achievement of health equity in the United States built on the strengthened nursing capacity and expertise. So you can see some of the threads, but a much stronger focus on health equity and the impact of nurses in our communities is pretty powerful. And I think as nurses, we we can underestimate our amount of impact. And for this report to really focus on the impact of nurses, both corporately and as individuals in our communities, is just powerful.
Really is powerful. The word that keeps coming to mind for me, Renee, as I'm hearing you speak, is emboldening us as a nursing workforce, right?
You just
And
fill in the space that our communities see us in, right?
exactly.
We are still like the most trusted profession over and over. And it's like stand up and fill that space that our communities want us to. And then how do we take action and work on that? Yeah.
Well, speaking of that, so you're helping to actively lead AORN's efforts around this most recent report. What have we done thus far in the perioperative arena?
Exactly. So there we honed down our areas of focus from this report to be nursing workforce, leadership, nursing education, nurse well-being, and emergency preparedness. Those were the ones we chose to focus on. So we've done a bit of an assessment and what have we done in some of the ongoing work and what are we working on. So for instance, nursing workforce, increased demand for nurses as well as a workforce that reflects the community that's being served. So that means what are we doing around diversity, for example? And we've had some internal and external with our members, strong work in just who are we? We are starting to collect some of that data so we better understand what our membership looks like and starting to be able to compare that to our communities for are we providing that diverse workforce? And then how are we working on early career and better supporting nurses? Nursing education. How do we better prepare our nurses to understand health equity and reducing health inequities so that we're improving the care and well-being? And so that's things like helping nurses understand what is health equity, where are some of the health inequities in our surgical population, and what are social determinants of health, and how does that affect me as a perioperative nurse? So we are incorporating some of those elements into most of our courses. As other courses come up for renewal or we're creating new courses, we're adding those elements in. So it's a constant in terms of our look and understanding of that. So we can be part of addressing those inequities in our communities. Nursing leaders, what do they need to better understand? How do I prepare a diverse workforce and then support a diverse workforce and how it looks to our community and what is going on with my community? And then kind of like advocacy is all nurses are leaders. So what is that broader role as nurse leaders, regardless of what the title is, right? We have some work to do around disasters and disaster preparedness as it relates to its higher level of impact on some marginalized populations within communities. So how do we, as perioperative nurses, become better prepared when there's a flood, a fire, things like that, in being able to respond and react to our communities? And that's work still needs to be done, but is a different lens, again, on where does perioperative nursing fit into that. And then health and well-being is going to be with us for a while, but the demands of the workplace, the work levels of work and the demands of the workplace and some of the leftovers from COVID continues with us, right? And so how can we as AORN be part of looking at that and better affecting the health and well-being of that workplace and therefore the care that they provide? So those are some things that we have been doing some work around and are looking at. So what else can we do?
Yeah, when each one of those, Renee, to me and what I feel when I love being involved in one of our DEI committees here at AORN, and we talk, like you said, to external members, members of our association that work inside hospitals that are also doing these efforts locally. And what really lights it up for me is the fact that patients want to see people that look like them taking care of them. And nurses want to also see that, future nurses want to see that, in the nursing workforce. You couple those two together and it really hits all the things you were talking about, correct? I mean, we need to promote all of the above to create a better nursing workforce that then creates a better experience for our patients, right?
Exactly. Exactly. And there's broad nursing issues and there's perioperative issues for us to better understand as we, AORN, participates with our broader nursing communities, ANA and others, on things, everything from how do we better prepare undergraduate students for the specialty roles that they're stepping into and engaging a more diverse nursing student population. Those go together, as well as how do we help our members with the increasing amount of health equity regulations that are coming at us. So, for instance, President Tolliver stood up a health equity task force that's looking at exactly that. What are these new regulations? How can we better prepare our nurse leaders as well as nursing teams to be able to meet these? And what's the additional education, toolkits, resources that are needed with a perioperative lens? So these are always have a broader nursing lens, but we try to bring the perioperative element to it to better prepare our work teams as they're trying to address these issues.
If you were to pick one or two things, Renee, of some of the current work that we're doing around this future of nursing, what would you call out?
I'm really proud of the work we've done with the Introduction to Perioperative Nursing, which is our undergraduate curriculum. It really, I think, stemmed from some of the 2010 report and how can we do a better job of advertising and educating about the specialty area of periop with our students. The program is great. And then the Chamberlain partnership just really fueled the growth in access to this. It's been exciting with their data that they've collected on their students using this to see the tremendous diverse undergraduate nursing population that has been engaging with this. And that really gives me and us hope for better having those teams that reflect the communities that folks are serving. So that's been very exciting. I think a different one, Jake, that you and I have spent a lot of time with lately is just what are the different ways that we can look at different models of care? It's part of health and well-being. It's also part of using our teams better. And Periop, we have this richness of technology in our environment, but I think we've been a little slower at looking at how can it really make our workloads for nurses better? How do we help with documentation? How do we help with maybe virtual nursing models for preceptor support or early career support and things like that? And really looking at how can Periop adapt and adopt some of the models that are out there that will really help us in our unique environment. And I think that's some really exciting things for us coming up as we understand how better to really make the environment that our nurses are working in be a safer, healthier environment with helping them use their nursing professional brains to really make an impact on care instead of doing a lot of tasks. That is our job. And that is how we really help nursing move forward in the future, I think.
Well stated. Well, thank you for joining Periop Talk today, Renee. It's been an absolute pleasure. Thank you for sharing your wisdom. We're all very excited to see how this work continues to evolve as we move forward.
Exactly. It's going to take all of us. It truly will, our broader nursing partners, as well as all of us in AORN to really make that difference in our communities and in our healthcare settings like we really can and are poised to do. So thanks for the chance to share some of this today, Jake. It's been a pleasure.
Thanks again to Renee for joining me. The Future of Nursing Report has been so impactful on our profession as a whole and for our setting in particular. Have you felt that impact? Drop it in the chat below. and we'll see you next time on Periop Talk.
Enjoyed the episode? Please like, comment, and subscribe. For additional Periop content, look for us on Instagram at AORNPics and on Facebook and LinkedIn at AORN. You can also find us at aorn.org. Thanks for listening.